Hi everyone, my name is Ryan Bentley, and over the next few minutes we're going to talk about what physician-assisted suicide is, why I think it should be legal in every state, and what the benefits of it are. Now I know it's a very controversial topic and everyone might not agree with me, and that's okay, because you have the right to your own opinion. Over the next few minutes, I'll help you understand the benefits of physician-assisted suicide, and know that the alternatives to it aren't always the best option. Now I know that many of us have known somebody, either friend, family, loved one, whatever it might be, who has suffered at the end of their life unnecessarily. Now what physician-assisted suicide is whenever the doctor of the patient administers a lethal dosage of medicine to help the patient pass on. It is no different than whenever we take our animals to the vet to get them euthanized. There are just a very few states that allow this right now, and those states are California, Colorado, Hawaii, Oregon, Vermont, and Washington, and also the District of Columbia allows it. Now, I'm credible in this because I have done quite a bit of research on it. I've worked in the medical field for a few years, and I've had a very number of talks about this and number of ethics classes I've had in my prior degree. Now, what physician-assisted suicide does is there's very many things that it does. One, it helps prevent suffering of the patient at the end of their life. It allows the patient to have a choice over their life. It gives the patient a dignified death, and it decreases the rate of suicide. Now, everybody should have the right to choose when their life is going to end. Everybody should also have the right to a dignified death. Nobody should be forced to sit there and suffer until they eventually end up dying. Now, it decreases the rate of suicide because the number of physician-assisted suicides are not included in the number of suicides. Now, some patients might, whenever they find out that they only have a few months, days, or whatever to live, and they might suffer through that, they might just end up ending their lives, and we don't want that. We want them to have dignified death. Now, there are some alternatives to physician-assisted suicide, and those aren't always the best things. One thing we can do is get the patient to make themselves a DNR, which means do not resuscitate, meaning that if they code, aka their heart stops, we will not do anything to bring them back. We will not give them chest compressions, we will not give them any medicine, we will not intubate them, or anything like that. Now, another thing we can do is if they are on life-sustaining treatment, such, like I said, as intubation or a ventilator that's breathing for them, we can take them off of that. Now, if they are unable to breathe on their own after that, they would end up suffocating to death, which would be a very, very horrible way to die. Now, another thing we can do is sedation, which I've seen that happen before. We just end up keeping them sedated, knocked out for the rest of their life until they end up passing. It is not fun to watch. It's not fun to be part of. No one wants that. Now, I know it's a very controversial topic, and you might agree with me, you might not. But let me tell you that nobody wants to suffer at the end of their lives. We don't want to watch anybody suffer at the end of their lives. Everybody should be allowed to have the choice over their life and when it ends. Everybody should have the right to a dignified death. Now, if it is legalized, that doesn't mean that doctors are just going to go run around and giving lethal doses of medicine to all their patients. Everybody should just have the choice of physician-assisted suicide. It should just be a choice that is offered to everybody. Not everybody's going to take it, of course. It should just be a choice that they are allowed to make. Now, if you believe in physician-assisted suicide and would like to get it legalized in our state, or whatever state you might be in, the first thing you can do is call your local legislation people and talk to them about it. Tell them why it's important to you, why you think it should be legal, and what you can do to help it. Now, like I said, there are other options to physician-assisted suicide, but those aren't always the best. It could end up lead to suffering, to pain that nobody wants. Now, if you have any questions for me or anything, feel free to comment under this video. If you agree with me, comment. If you don't agree with me, I'd like to hear why you don't agree with me. I'd like to hear everybody's opinion. I just believe that everybody should have the right to a dignified death, and there's no dignity in just laying there and suffering for the rest of your life, however long that may be. It should be a human right to be able to choose when our life is over. Now, I know that people can, like I said earlier, just commit suicide. Nobody wants that. That's not dignified. It should be a human right to have a dignified death and let us choose whenever we want to go. Like I say, if you agree with me, comment. If you don't, comment. I want to know why. Thank you for your time. I hope you understand. Y'all have a good day.